Hello everyone and welcome back to OSCE's case for today. Today I'm going to walk you through each step in the case. So let's get started as you're standing outside your door. Outside the door you have about 10 to 15 seconds. You see the note. This is your cue to prepare yourself for the case ahead. Here you see a doctor is coming to get a recommendation regarding a mutual patient. So today we're having an interprofessional collaboration case. Once you get into your door, you see Dr. Jones. Once you go in, you just have a seat, and when she comes into your room, you greet her. Hello, Dr. Jones, and then you introduce yourself. I am Ria, or whatever your name is. I'm the pharmacist on duty today. How could I help you today? Hi, Ria. I'm Dr. Jones. I work as a resident physician in our hospital. I have a few questions regarding a mutual patient from you. I need your help in getting the answers. For sure, Dr. Jones, I would be happy to help. Please have a seat. And if you could just let me know what are your questions for today, I would definitely like to help you out. Thank you, Ria. We have a mutual patient. His name is Jacob. He's 2 years of age. He came to our hospital recently, and I've diagnosed him with moderate Croup. I am thinking of giving him a 6 milligram oral dose of dexamethasone. I was hoping to see what else I could do in order to improve his condition to make him feel more comfortable. Perfect. Thank you for your question, doctor. Do you have any other questions for me? I do have one more question, Ria. I don't know if I should keep her in the hospital or I should discharge her. Any sort of idea if you could give me regarding those would be appreciated as well. The good part here, FYI, is that we asked the doctor right away if she had any other questions. Usually, the doctors or the patients would wait for the 2-minute bell to ring before giving you that second question. And when you are in a crunch of time, it's hard to think. So it's a good idea to ask her and get over with the questions. Maybe write them down if there are multiple questions so we don't forget to answer those questions for her. Thank you, Dr. Jones, for your questions. I'd like to go through the patient's profile together to get all the information I can before I give you an informed answer. For sure, Ria, let's look at the patient's profile and ask me any questions you may have. The patient's profile will be given to you on the OSCE station. You can double check the patient's name, date of birth, any new allergies, and any medications that you don't have on file with the doctor. Once you ask them and you confirm that this is the latest profile, you can go ahead and you can answer the questions. Now, in order to do this, in this case, it's a very straightforward profile. It's a 2-year-old kid who's 10 kgs in weight. He has no chronic medications on file, and he has been diagnosed with moderate Croup. The prescription given to him is dexamethasone 6 milligrams stat. So let's go ahead and let's try to see with our reference as to what the answers to the questions for the doctor may be. Again, use your time wisely. This reference or some reference that is similar to this will be given to you on the OSCE station as well. Again, try to use the reference and the reference only in order to answer your questions so that you don't give any outdated tips or answers, and you look for the answers that your assessor is looking for, which is usually going to be in the reference given to you. Now, the first question for the doctor, as you may recall, would be if it was the right dose. The second question was how to minimize the discomfort the child may be experiencing. And the third was if the patient should be discharged or hospitalized and how to know what to do when. Once you get all those answers, do not mark anything on the reference. Write those down quickly on your sheet, or maybe just make little mental notes of where to find the answers. My usual trick was to intermittently look up at the patient or the professional and read out straight from the reference so that I'm not muffling my answers, I'm not having a little bit of a gap between my letters, not looking unprofessional, as well as giving them the right answer at the right time. So let's go ahead and let's answer our questions. Thank you for your patience, Dr. Jones. As per my reference, the oral dose for dexamethasone for a child in case of moderate Croup is 0.6 milligrams per kg. The patient does weigh 10 kilograms as of today, so having a 6 milligram dose is the right dose. In order to minimize the discomfort, you could give him a position of comfort or place the child in the parent's lap. Answering your third question, you need to observe for any sort of chest wall indrawing or any stridor. In case none of them is present, the child should be okay to be discharged. In case there's no or minimal improvement in 4 hours, hospitalization may be considered. I hope that answers all your questions. Thank you.